Good evening. I'm Steve Mencher, News Director here at Northern California Public Media. Welcome to our Coronavirus Virtual Town Hall for Tuesday, March 24th, 2020. And here's why you're starting to think that every day feels like a week or a month. Just today, the International Olympic Committee postponed the summer 2020 Olympics in Tokyo. One of America's greatest playwrights, Terrence McNally, has died of coronavirus. After a 2-week tryout, Sonoma County has given the title of Public Health Officer to Dr. Sundari Mase, removing the interim from her title. She'll be with us on the program in just a few moments to answer your questions. Please continue to send those questions to viewer@norcalpublicmedia.org. Christopher Godley, Sonoma County's Director of Emergency Management, will also be joining us live. 1.3 billion Indians are now locked down in their homes. Greta Thunberg, the young Swedish climate activist, announced that she had symptoms of COVID-19 and that it was extremely likely that she had contracted the virus. She's mostly better, but challenges young people not to be overconfident and obey social distancing. And 3 Santa Rosa police officers have tested positive for COVID-19. Now, we're going to start the program with an interview I did Monday morning with Susan Gorin, Sonoma County's top elected official. Much of what we talked about yesterday has shifted, but the information is still relevant. I'll come on afterwards with some updates. Here she is.
Hi, Susan. How are you this morning?
I'm doing so well. It's great to visit with you and everyone virtually.
All right, thanks. I've got lots and lots of questions today, so I hope you might have answers to some of them, and I imagine you won't have answers to others, so let's get started. There was a crush all up and down the California coast this past weekend of folks who said, I don't want to be cooped up anymore, I'm going to the beach, and some of the beaches were just overwhelmed. Tell me what the county has heard, what feedback you've given, and what you think we should do next about this exodus of folks on the weekends to hang out at the beaches.
Well, I think, first of all, the rush to all of our regional parks it should have been anticipated when we announced that parking would be free. And we've had 4 or 5 days of people being sheltered in place in their homes and away from schools. So it is very natural that families especially would want to give their children an experience out of doors, as the perception is it's the healthy place to be, both physically and emotionally and spiritually. And whoa, what a crush of people we experience along the coast and in other regional parks and state parks as well. I took a hike at Annandale and I saw maybe 2 people yesterday, but I understand the parking lots at the state parks were full yesterday or Saturday as well. So the county is very concerned about this. And I think the most important message that I can convey is sheltering in place means exactly that. The more that you get in your car for joy rides or certainly frequenting faraway regional parks or state parks, the more exposure you provide for yourself, your families, and certainly for others. We've learned from other nations that as soon as they relaxed the sheltering in place order, that the rise in COVID started to increase again. So the message, and it's not just our regional parks, it is, I'm very concerned about the folks accessing shopping with their entire family at Target and Walmart and Costco and Home Depot. And we're trying to figure out a sensible way of doing this to provide some educational and physical enrichment. The advice that I can give to you is get your bicycles out of the garage, take a family bike ride, a couple blocks or more. Don't expect restaurants to be open. You may have some fast food restaurants, but limit your physical activity to the area around your house, the area that you can walk and bicycle to. Please do not get in the car. Take your travel trailer somewhere else. This is the worst possible thing that you can do.
Let's jump now to personal protective equipment. Tell me if I'm wrong, but I believe I saw that the county itself was asking the community to donate personal protective equipment, or what they are now calling PPE. Of course, the medical folks have called it that all along.
Yes.
Tell me about the initiative for the county to get involved in something that the state and federal government should really have their eyes on.
I think our state and federal government should have ramped up production of the masks and ventilators and swabs and test kits long before they galvanized into action most recently. But here we are. We are county prepared. Many of us do have those masks, the N95 masks, because we've weathered through several disasters with our fires and smoke enveloping our community. So if you are like me, you have a little package of masks hidden in your closet or your car somewhere, or your go bags. We really want a protective devices in the original packaging. We want to make sure that they are new and safe.
And where do you
Please,
want them?
we want them to the Salvation Army at 93 Stony Point Circle, and I think there'll probably be someone standing out front. But if you have gowns, nitrile gloves, anything that you could help our healthcare providers and our first responders be prepared for, please donate them, because we need you coming forward now.
Sure, but my understanding, Susan, and please stop me if I'm wrong, is that what's really asked for is not simply if you have a mask or two lying around, but if you're a company who provides hundreds or thousands of these to your construction workers or to your factory workers, or if you are an organization that has stockpiled these, this is really what you want, is the kind of wholesale rather than the retail one-offs.
Absolutely. And we really want to thank all of our Freedmans and Home Depot and Keysight for stepping forward and recognizing that we are in an emergency situation. So unload those shelves and donate them to the desperately needed supplies for our first responders.
Okay, thanks so much. Now, Susan, tell me, here you are doing your county business from your home. I imagine some very, very high percentage of county workers are doing that. Is the county really prepared to have its workers work from home?
We're going to try the brave new world of holding a board meeting tomorrow through WebEx. If you, and one of the items, we will be having a briefing on the COVID crisis that we are experiencing, and have an opportunity, I think, for the first time for the board members to comment, because all of us have been on the phone talking with various sectors of the community, trying to identify what the needs are. But immediately after that, we will be perhaps recommending, but certainly reviewing an emergency ordinance for waivers or moratoriums of eviction notices.
That's exactly was going to be my next question,
Yes.
Susan. So let's deep dive into that. I asked you that last week. There was not a good answer as far as I was concerned. So I really want to hear this. Please, I'll shut up. Go ahead.
Well, I think last week was a little premature. Our county council was busy talking with all of the city attorneys and county councils throughout the state. I would have preferred this to happen at the state level rather than city by city, county by county. But here we are. And I can, while we're talking, go on to the information. But I do believe it may be in effect during our emergency declaration period. But here's the key to the public. And I've had probably 5 to 25 different emails each day asking for this. I do know that some landlords are appreciably concerned about this. What does that mean for their security of their home? Are they going to lose their home, and then therefore someone would be out of lunch or out of the home due to evictions? Lots of questions to be asked for sure. But the most important point is we recognize that so many of our not lowly, but minimally paid employees are paycheck by paycheck, really nervous about being evicted from their home. We're already struggling to try to identify places for safe distancing for our homeless population. We do not want to add to that crush. So we are on it. It creates an affirmative defense for any residential tenant who can demonstrate that they have received a notice of eviction for failure to pay rent, and that such failure is related to a substantial loss of income or substantial out-of-pocket medical expenses resulting from the novel coronavirus pandemic. Its urgency ordinance also provides for a tenant who utilizes this defense share that information with the owner of the property to support an owner's claim for any prospective mortgage relief due to impacts resulting from the coronavirus pandemic. And again, it's designed to facilitate the implementation of the governor's and public health officers' orders to shelter in place and to reduce additional instability in our community.
That's fabulous, Susan. That's really great. This I think is probably the most important thing that the board will do tomorrow. From my point of view, it will immediately make people feel like I'm not going to get kicked out of my home.
I've been receiving a lot of emails from folks very concerned about that property tax deadline of April 10th.
Yep.
And just for their information, this extension or moratorium waiver comes from the state level. We do not have the ability to waive that locally. And I know that in the worst possible time with people out of work, they're worried about paying their property taxes, but we will be having future conversations with the state. Our auditor, controller, tax collector has been hard at work and details will emerge, but I wish we could simply wave the magic wand and extend that deadline, and sadly, we cannot.
All right, Susan Gorin, Chair of the Board of Supervisors, thanks for all you're doing, and thanks for being so available to chat this morning.
Thanks, Steve. I look forward to our next opportunity.
All right, so long.
And just so that we understand that the interview that I did with Susan Gorin was yesterday morning, that was probably a few light years ago. So let me update that a bit. We talked about the county parks. County parks are now pretty much closed. The fact that folks streamed out there over the weekend and didn't do social distancing meant that the parks could not stay open. The biggest news, though, is that the county did today pass the Eviction Defense Ordinance, and I'd like to read some of the highlights of that from the county's press release that just came out today. The Sonoma County Board of Supervisors today passed the COVID-19 Eviction Defense Ordinance, effective immediately for 60 days after the end of the local public health emergency. The new ordinance aligns with the governor's executive order N-2820, which authorized local jurisdictions to suspend evictions for non-payment of rent for reasons associated with the coronavirus. This is an important step in protecting public health and the well-being of community members who may be experiencing a loss of income or increased medical costs associated with the coronavirus, said our friend, Board of Supervisors Chair Susan Gorin. The ordinance is designed to help our community comply with local and statewide directives to shelter in place while preventing evictions and utility shutoffs associated with financial and medical losses due to the coronavirus. The ordinance creates a legal defense for all renters who can demonstrate that their failure to pay rent is due to the coronavirus pandemic. Tenants who use this defense are required to share that information with their landlord to support claims for any prospective mortgage relief. Next up, Assistant News Director Adia White talked with Juan Prieto today. He's communications strategist with California Immigrant Youth Justice Alliance. The alliance is focused on advocating for undocumented youth and their families. Adia and Juan talk about how the undocumented community is disproportionately impacted by the epidemic and what resources are available. Let's see that interview right now.
What resources are available in the Bay Area specifically for undocumented families right now? I think at the moment, there's been conversations that are being had with electeds at a city level. I know in San Francisco, Board of Supervisors are beginning to think about ways that they can create resources for undocumented people. There has been nothing set in stone yet. That's why we as an organization have taken it upon ourselves to collect any sorts of resources that might be accessible to undocumented people during these times of crisis. And so along with that, we're also trying to gather any sort of crowdsourcing efforts that are trying to create resources outside of state-funded support that can be accessible to undocumented people. Of course, that's not enough support, right? The crowdsourcing that is being led by grassroots organizations, the capacity to support all the people that are reaching out for help isn't enough. So we need cities, we need the state of California, we need the governor that if he's thinking of creating monetary support for Californians, that he thinks about undocumented Californians as well.
And what kind of needs are the families that you work with expressing right now? You work with many undocumented families in the Bay Area specifically. What are you hearing from them during this time?
Yeah, I think what this pandemic is highlighting is the not the differences that people are trying to create to distance ourselves from one another, but the similarities, right? The same things that citizens are suffering with, right? Layoffs, not being able to pay rent, fear that their loved ones might get sick. These are the exact same fears that undocumented people are facing right now, without the consolation that there might be some sort of state-sponsored support. They're not counting on $1,000 to be given to them by the federal government. They're not counting on any sort of monetary support at the moment, right? And so I think it's important for us to advocate for that side of the conversation, because undocumented people are being continuously left out of creating those sorts of support mechanisms. And so at the moment, I think a lot of it is being initiated. Like a lot of those conversations are being initiated with local electeds and even pressuring Governor Newsom to create some sort of support, emergency support for undocumented people, but nothing has been tangible just yet. That is why we're sort of trying to encourage people to lead their own crowdsourcing pages for now, and as an organization with a big digital platform, then trying to uplift those crowdsourcing efforts.
And how are the federal policies impacting undocumented families right now? I know there's been a lot of changes recently, for example, the public charge rule. How are people responding to these new policies, and how is that impacting their ability to seek resources?
Yeah, exactly. I think undocumented people need to understand that this is a time of crisis, right? And any kind of support that we're putting on our website won't be anything that affects the public charge rule. Even receiving emergency Medi-Cal, right? I think that's something that we're trying to highlight for undocumented people who think that they might not be able to seek medical support. If an elder or someone with diabetes or someone with asthma gets the coronavirus or COVID-19, that they can still seek medical support, that it is essential to seek medical support. And so there's that sort of information we're trying to clarify it on our page where we're gathering all these resources. Yeah, it's just a matter of ensuring that we're pushing away misinformation, and specifically with public charge, right? The fear that if I'm seeking support, then somehow it's going to affect my legal status in the future is a very legitimate fear, but I want to console undocumented people. And knowing that the state of California has very different policies, and Medi-Cal is a California-specific resource. And I encourage undocumented people, if they fear that the virus, and if they're immunocompromised, to go directly to a hospital and get emergency Medi-Cal, which they will qualify for.
And for those who aren't aware of what the public charge rule is, can you kind of unpack that a little bit and explain why people might be afraid to seek resources and healthcare specifically under this rule?
Yeah, so I mean, public charge is a way for the administration to try to limit the way working class people can also apply for citizenship. And so it specifically tries to put the burden of financial strain on immigrants, and saying that if you're seeking out federal support, that that'll impact your legal status in the future, or your ability to gain legal status in this country.
And I want to talk a little bit about language barriers as well. Do people who don't speak English as a first language, do you feel like they're getting emergency information and information about resources translated into the languages that they speak throughout the Bay Area?
Yeah, I haven't seen efforts of the sort just yet. I think for us, our resource guide is in English and Spanish because those are the languages that are accessible to us. But of course, undocumented immigrants come from all over the country. And so if folks are out there trying to find ways to support, I encourage people to visit our website and look at our resource guide and reach out to us to see if there's ways that they can support in translating these documents, because the information needs to be disseminated across not just the Bay Area, but across the state and across the country in different languages.
Right. And I'm wondering if you can talk a little bit more about how some of the barriers for undocumented families in general impact kind of all communities throughout the Bay, because I know that, this virus affects everyone, and the way
Yes.
that any individual responds to this has the potential to impact, a lot of people. So can you talk a little bit more about how we're all kind of connected during this time?
Yeah, I mean, I keep telling people that we're only as safe as our most vulnerable community. This pandemic is not just affecting American citizens. This pandemic is affecting the world, and how we respond to it with compassion, humanity, will reflect on how many lives we're able to save. And so an undocumented person receiving support means that other folks won't get infected, right? That the disease will be stopped where it's at. I think it's a moment for us to think about the ways this pandemic can unite us, right, as a front, as a human front against a pandemic that's taking lives because we don't have the capacity to provide the health support necessary. And so, to us, everyone is safer when we're all safe, including undocumented people. And so I think it's crucial for people as they're creating resources and thinking about ways to create medical support for people to stop this virus, that undocumented people are a part of the conversation, that we don't leave anyone out, because leaving one person out can mean thousands of others will get infected in the future.
All right, that was Adia White and Juan Prieto of the California Immigrant Youth Justice Alliance. I'm joined now by Sonoma County's brand new public health officer. I understand that today they removed the interim. They must have been working on the glass door and changing the title, but congratulations.
Thank you very much.
And I also understand, and I believe you've heard this news, that yesterday your colleague to the south, Dr. Matt Willis, just tested positive. He's the public health officer in Marin County, just tested positive for coronavirus. Do you know Dr. Willis?
Yes, actually, I know him quite well. I worked with him while at CDC. He's a good friend and colleague, and my message is that our thoughts are with him now at this time.
All right.
And it also underscores the fact that anyone can get infected with the coronavirus.
All right, so let's move on. I know you've brought some slides to kind of update us on exactly what's going on right now in the country and in the county. So what's the latest?
Yeah, I want to give you some updated statistics. So now worldwide, we're up to 415,000 cases. And here in the US, we've jumped to 52,145 cases. And in California specifically, 2,327 cases as of today. And if you take a look at the next slide, I'll show you a breakdown of what's happening in terms of the slides, that is counties in the Bay Area. And as you can see, Santa Clara still has the most cases. I think they're at about 375 now, followed by San Mateo, San Francisco, Alameda, but we're right up there. We have now confirmed 34 cases. That includes our one death that we notified people about last weekend, and 2 persons have recovered completely. I just want to note that last Friday was our big jump. We went from 11 and doubled our cases to 22, and again, today at 34.
All right, let me jump right in now to viewer questions. A lot of them have been coming in, and this is really why we're here today. We want to have the community be able to tell us what's on their mind, and you to answer these questions to the best of your ability. So let me jump right in. This is from Petaluma. I just read this on SoCo Emergency. There's currently a shortage of resources to collect specimens for testing. Currently, there are enough tests in the county. So that doesn't make a lot of sense to this questioner. There's not enough resources to collect the specimens, but there are enough tests. Can you unpack that for us?
Yeah, definitely. So you have to collect the specimen first, and that requires a swab and a kit with some transport media, and that is what we have a shortage of right now. And we're very, very happy to say that Kaiser has sort of stepped up, agreed to share some of their resources with other hospitals, emergency departments, urgent cares. So we are able to test those who really need testing at this time. Now the test itself is performed at the laboratory. There we're fine. We have plenty of ability to test patient specimens once they get there.
Okay, and then along the line of testing as well, how many testing locations are there set up in Sonoma County? Where are they located? And when, let's start there.
Okay, yeah, I mean, there's many different testing locations, meaning places where you can see your doctor and have a specimen collected. So our hospitals are doing this, urgent cares, clinics. Of course, we do advise that if someone has symptoms and wants to be tested, that they call their own doctor first, make an appointment, go in, and you'll be sent to a location where you can get testing if it's deemed necessary.
Okay, so the second half of that same question was, when will there be a sufficient number of items like ventilators and masks for medical and caregiving personnel?
Yeah, that's a really good question. In fact, I'm going to put out there that if we have folks at home that have masks, even 1 or 2 unopened masks, gowns, gloves, goggles, then please do bring them to the Salvation Army on Stony Brook Circle.
Stony Circle.
Stony Circle, that's
Yeah.
right. Because we'd love to have those donations. We are short on some of those PPE or personal protective equipment, and so we'd love to have your donations. We're waiting to get more from the state of California and the federal government.
All right, and I don't mind being corrected. When I was talking to Susan Gorin, my understanding had been we want those by the dozens, by the hundreds, by the thousands. But lately we've been hearing from the medical personnel, we'll take them by the 1s and 2s as long as they're unopened and they're clean and they're ready to go.
That's right. We'd love to have them by the thousands, of course. But I think even if you have a few or even 1 and you're willing to give it up for a good cause, bring it on in for us.
Okay, here's a question from Kathleen Haney of Pengrove. It was reported that you would give out information about the gender, age, location of where they contracted the virus. How many have been hospitalized and how many isolated at home when we reach the number 50? Now we're at 34. So what's rationale for not giving this information out at 34? How does that difference protect privacy? It would help to know where to be particularly careful.
Yeah, and this is a really good question. And the key here is that we do want to protect our patient confidentiality. And so the number 50 is a number that's been used, and other counties have also used that at a time when they can release some information. At that time, we feel very safe that by giving the age distribution of our cases or the gender distribution, even potentially the numbers we're seeing in different parts of the county, that we'll be safe in protecting individual patient rights at that point.
All right, but this is we've gotten so many of these questions that let me push just a little bit.
Sure.
If you said there's 34 cases in the county, 25 of them are in Petaluma, and so if you live in Petaluma, you better be especially careful in going out and not touching anything and getting together with the folks in your community. Can't you figure out that nobody's going to be able to look at the however many tens of thousands of people live in Petaluma and say Joe's got it, Bob's got it, Jane has got it?
Right, no, I think it's a good question. But we've decided and put out with our privacy directors that we will choose that number to be 50, and the information will be forthcoming. And for now, I just want to tell people that this information will be important for you, but it's most important that you follow the directives that we put out. Nothing's going to change in terms of the recommendations that we're making. We're still going to talk about shelter in place and the importance to follow that order, the importance of social distancing, the importance of all of the personal hygiene measures we've talked about. And that's not going to change based on whether we tell you this many cases are happening here or there, or the gender of our cases.
All right, now I've got a friend who's been encouraging me to wash my hands like a doctor. She saw me putting on the soap, washing off the soap, and my hands stayed under the water for another 20 seconds. She said that wasn't very impressive to her. How should we be washing our hands?
Well, I think we just have to use our common sense. Wash your hands frequently, especially when you've touched other surfaces, with soap and water. If you don't have soap and water, use hand sanitizer. I think just using good judgment is the most important thing. If you're coughing and sneezing, make sure you do so into a tissue or in the crook of your elbow. Just use common sense.
All right, here's another question from Donna in Santa Rosa. Is it possible that nurses who currently do not work in acute care settings can be called to fill spaces in hospitals or emergency hospital settings? Is there some way that they can go sort of back and forth? Or I'll ask also in New York, they asked for retired folks to come forward and tens of thousands came forward in a day. Tell us about that, how we can better use our medical personnel.
You know, these are all things that we're discussing right now as we have our surge planning in case we need to call in more healthcare personnel and have alternative care sites for persons that don't need to be in the acute hospital setting. So I think these are all good sources, and we have to work with our healthcare partners to determine what's the best approach. But we have a plan in place, and when we need to have additional staffing, we will definitely be able to call on the appropriate personnel.
Like retired folks, like people who might
Exactly.
be able to move back and forth from different medical settings.
Sure, yeah.
Okay.
But of course, with all of our facilities on board.
Okay, now I've got a question from Facebook. How does closing public restrooms help prevent the spread of COVID-19? I guess public restrooms in the county are now closed?
Yeah, I think the thought was that, especially when we had many people visiting public restrooms in the parks and beaches and that sort of thing, there wasn't the adequate ability to clean and sanitize these restrooms. So there's a worry that if many people were going to the same place and touching different surfaces, that it could be a real hotbed for potential infection.
Okay, so today, another question from social media. Today, Bill Gates stated that it's now possible for people to self-test using shorter swabs that would also be safe for healthcare workers. So I guess you would self-test, you'd put the swab in a test tube of some sort, then you'd bring it in somewhere, no one would have to touch you, no one would have to touch the swab. Tell me about the very latest in testing and when we could see it here in Sonoma County.
Yeah, I think that is a good option, but it's going to take some training and education because, of course, we need people to take the appropriate specimens. And when we do it as healthcare personnel, we know exactly what to test, where to test. So I think with good training, education, guidance, videos maybe, we could move in that direction. We're not there yet. I just want to point out that there is a new laboratory test that's coming out by Cepheid. I don't know how far out we are, but it's a rapid test for coronavirus that would give a result within a few hours, and that's on the brink now.
All right. Now, let's talk one more time about testing, because I want to, we've had this conversation for 3 weeks now.
Yes.
And I hear on television from certain public health officials that the best thing we could be doing if we had the capacity was to test everybody. Mm-hmm. Testing everybody would mean we knew who had it, who didn't. We could isolate the folks who had it. Tell me, would it be best to test everyone?
I don't think testing everybody at this time is feasible or appropriate. I think we really need to focus on the high priority individuals. We've already been talking about this, but I do think we need to get out there and test people. In other words, folks who have come in contact with somebody who already has COVID-19 infection need to be prioritized. And symptomatic individuals that are ill, that have underlying medical conditions, that are older, our healthcare workers, our first responders, people in congregate settings like our nursing facilities, the prisons, these folks all have to be prioritized and need to be tested. And then people who are symptomatic that come forward in the community also should be evaluated and tested if necessary. I don't think we should test everybody across the board, however.
If you could wave a wand and have enough tests for everybody, you don't think it would be useful?
Well, any test has its limitations. There are false positives and false negatives. So the whole thinking clinically is that you need to have a reason to test before you test somebody. That's the way it is with any illness. And so if you don't think a person has COVID-19, there's no reason, no symptoms, no contact, nothing, there's no reason to test that person.
Okay, thanks for, and I, don't mean to be unfriendly in my pushing. These are the questions that we've been getting.
No, I think they're really good questions.
Okay, here's another one. If you experienced the flu earlier this year, do you have built up antibodies from the flu that might make you less susceptible to the coronavirus?
They're different. They're different viruses, so I would say no, you don't have any antibodies from influenza towards coronavirus.
How about this question of whether you can get coronavirus twice?
That's a very good question. It's a novel coronavirus, so we don't have a lot of experience yet with it. So I think over time we'll see whether that's possible. But once you have it, you should be able to build up some immunity towards being reinfected.
All right, so you think, and I know that they're using blood from some folks who have had it, looking at their blood, looking at those antibodies, and seeing if perhaps those would be helpful in treatments or vaccines or cures. Do you have any information that you've read about that?
Well, those are all still in the experimental phase, and I think it's really great that we're doing the research, and hopefully something good will come of it, but now there's nothing that we would apply at this time.
Okay, here's another question for you. I would like to know what the protocol for those tested for the virus need to do while waiting for test results. I'm concerned my neighbor, 50 years old, was tested and is out keeping social distancing but not self-isolating. The others in her home are either elderly, there's a mother with COPD, a roommate who is being treated for bronchitis and asthma. I haven't seen anything about the actual process, and I am greatly concerned.
Yeah, I think it's a good question, and let me just say that if you are being tested for COVID-19, then probably your provider thinks that there's a good chance that you have it, so you should definitely isolate yourself at home. Of course, if there's others at home that could be more susceptible, elderly or people with medical conditions, then we need to discuss where you might want to quarantine yourself. Maybe at home isn't the best place. So this is another discussion that we're having about the potential for alternate care sites where we can have people stay while they're waiting for test results or waiting to get over symptoms where they don't infect others that are susceptible.
Right, and not to turn this into a political discussion, but Rand Paul, who was tested and went to the Senate gym and the Senate pool, you're not recommending that folks be out and about?
No, not at all. In fact, I'm quite sure that people should stay put.
Okay, finally, there's a question of whether we need blood. I know one of our political leaders is working on blood drives. I know that blood drives are going on throughout the community. Do we need blood, and why do we need it?
Well, I think we have routine blood drives and collection because we don't have an unending supply, and so I actually think that may be considered an essential activity, and if we can perform that with social distancing, that we should absolutely go ahead with essential activities.
So you think it would be our blood supplies are running low in the county?
I wouldn't say they're running low. I just know that routinely we do have blood donation.
Okay, thank you so much, Dr. Mase, and congratulations again. I know this is trial by fire or whatever you'd want to call it, so thanks.
Well, thank you so much. I'm really excited to be here and to contribute.
All right. I want our viewers to know that they can still send us questions on email. We're at viewer@norcalpublicmedia.org. And if we don't get to your questions today, we're going to pass them on to the county and hope to do this town hall regularly. Also, if you're just tuning in and you prefer to listen to us in Spanish, tune in to KJOR La Mejor, 104.1 FM in the Santa Rosa area, and you should be able to find the Spanish dubbing done by our hardworking interpreters, and we want to make sure to thank them for their help. They're really doing a fabulous job. What we'd like to do then, we get their dubbing in Spanish and we put it into a video and we make that available to the community as soon as we can. So we're really pleased that they're doing that. Thanks so much. All right, Chris, you've been listening out there, and we're glad to have you with us.
Absolutely wonderful to be here and share this with you tonight.
I can tell you're flagging just a little bit.
Is it that obvious? Yes, it's been a long month.
Oh boy, and what day is it? Yes, it's still March. All right, some questions. We're going to jump right in. Chris from Santa Rosa wants to know, Since flights at the Sonoma County Airport are continuing, is there a COVID-19 screening process in place for all people entering our county from all over California, Washington, Oregon, Colorado, Arizona, and all the other places where folks can fly in direct to Santa Rosa Airport?
That's right. At this point, there's no formal screening process like you'd see at the major international hubs. And honestly, the screening is of limited value. It's only detecting the condition of an individual for a very small moment of time. So actually, most folks that might climb on an airplane that have COVID-19 would not be detected either prior to boarding the aircraft or even getting off the aircraft.
So there's no point in setting up a big screening system at the airport there in Santa Rosa?
Well, not for Santa Rosa so much, because we're looking at relatively small local regional flight travel. We're not invested in that large cross-country travel, or especially international.
All right, let's have another question that we received from Mark Smith in Rincon Valley. Looking at the reality of federal arguments, state capacities, and COVID-19 persistence, is Sonoma County currently organizing food and home supply pickup stations in case this lasts more weeks and months? And is the county also organizing food and supply delivery and pickup services as we recover?
Absolutely. Our job is to think about what if this does extend? What if it does become more significant? And so to that end, food is very important, especially because we've disrupted our social fabric so extensively. And so we have invested in, and just today are signing contracts not only with the food bank, but also with 3 other community-based organizations that will be able to acquire food, prepare it, and deliver food, especially to our most vulnerable populations. And as necessary, we'll ramp that capability up to support more and more people.
Tell us then how, if you're at home, you've lost your job, you don't have any money coming in, you're living paycheck to paycheck, the cupboards are starting to be bare, what's your first move?
Well, the first move, of course, is to connect with our own internal social support networks, friends, family, those folks who we may be able to turn to for not just once, but several times to help us through those hard times. But of course, the safety net is there, and it's going to be strained during this event. So we want folks to do as much as they can to take care of themselves and each other as possible. But it's certainly a best first stop may be the food bank, and they have an excellent food sourcing resource guide, especially online or calling them, where they can help you identify what are the particular needs or interests you have relative to food security, and then they can help you address that.
So the food bank, do you mean Redwood Empire Food Bank?
That's correct.
And you'd find them online?
Yep. Just Google Redwood Empire Food Bank, and there's a good food resource guide there for you.
And you're working closely with them?
We are now. We believe that they are a linchpin in not only the day-to-day function of our community. They really do help the most vulnerable, the folks that are down on their luck for that period of time. But now, in this time of crisis, they are stepping up and they're expanding their capabilities.
All right, that's good to know. Now, here's a tough question you may not have the answer to, and you only have a minute or so to answer. Having had over 10 years, or as many years as you'd like to think, to prepare for a pandemic, why are local hospitals in the county so poorly prepared and don't have sufficient stockpiles of masks, gloves, ventilators, even now at the very beginning as this curve is happening?
Absolutely. I would say it's symptomatic of the larger condition of our medical healthcare industry. For many years, it's continued to suffer from financial strain as well as increased demand for services, and preparedness for a hypothetical event like a pandemic is simply just one aspect of that condition.
So, you know, I guess you're learning lessons. Maybe we'll be better prepared next time.
Well, that's always the key. And of course, as we go into this event, we're drawing on the lessons learned from 1918, 1967, as well as other pandemics that have occurred in history.
All right, Christopher Godley, Director of Emergency Management, thank you so much for everything you've been doing.
Thank you.
All right, as we move this week to broaden our panel of experts, Assistant News Director Addie White reached out to Dr. Arthur Reingold. He's Division Head of Epidemiology at UC Berkeley School of Public Health. Dr. Reingold was on a touchy Skype connection, but I think the information that he has to share is going to be critical for all of us. Here's that interview right now.
Dr. Reingold, I'd like to start by talking about the different responses that various countries have taken to the coronavirus. Can you kind of compare and contrast Italy versus South Korea versus China, and who you think has kind of done the best to stop the spread of the coronavirus?
Well, I think if people are probably pretty familiar with the fact that in China, that China did start responding. They did so in an incredibly forceful manner, using the military, using the police, and really not only cordoning off the entire area and not letting anyone enter or leave, but when they did identify infected individuals, really forcefully preventing them from exposing others. I think the evidence is that in both places like Korea, South Korea, and Singapore and Hong Kong, that people did successfully also at least slow the spread and potentially bring things under control without being as forceful. But they did it in large part through extensive testing of individuals. And then when they found people positive, not letting them expose other people. So that approach, while not as draconian as the approach in China, certainly was relied on a system and resources devoted to the problem. So those appear to have worked. Italy, and perhaps behind it, some other countries in Europe like France, I think have clearly have yet to succeed in bringing their outbreaks under control and seem to still be growing in size. And so whatever they've been doing there, and I think it's been incremental, and particularly in terms of the forcefulness with which it's been brought to bear, they still have more to do if they truly want to bring things under control. So I think the lessons for the United States, again, we've been quite late in the United States responding to this. I think most people in public health believe that we should have been acting more vigorously much earlier. That would have been easier if we had access to widespread testing. And at least based on my discussions with friends who were on the front lines of clinical medicine, even as of the end of last week here in Northern California, it's still not easy to get a test for a patient who you'd like to make the diagnosis in. So whatever the messages are from on high, that anyone who needs a test can get a test, that's really not true. Frankly, certainly here, and from discussions with friends in Boston and elsewhere. So we've been hampered in our response by not having testing available. And I would say generally not being completely persuaded early on that this was something that required a forceful response.
What about the Bay Area specifically? I know that California ordered a statewide shelter in place, and the Bay Area was ahead of the state in that manner. Was it soon enough and aggressive enough to flatten the curve in order to allow our hospitals to have the adequate resources to respond to the number of cases that we might see here?
Well, as I said, I have friends working in emergency rooms and intensive care units in the Bay Area, and they're pretty busy. They're struggling with the whole question of having to put on personal protective equipment to do appropriate procedures on very sick patients. So they're very worried that in the next couple of weeks, they could run out of sufficient equipment, that the numbers of cases will go up and that they'll really be struggling. I think at the moment they're managing, but there is a concern that our system could be, at least for some period of time, overwhelmed here in the Bay Area. So I think that it's a real concern, and at least for the coming few weeks, I think it's an open question.
Is there anything more that you think that public officials should be doing in order to ensure that we don't see a surge of cases in the next few weeks that overwhelms hospitals?
First of all, I think we are going to see an increase in cases in the next at least week or two. So I think in terms of whatever was done in our 6 counties, whatever the governor did, those are still relatively recent from an epidemiologic point of view in terms of the incubation period of this virus and the number of people who are probably infected in the community. So I don't necessarily expect to see an impact of those measures for at least a couple more weeks. I could be wrong, but I think it'd be incredibly optimistic to think we'll see a flattening of the curve, as you called it, in the next week or 10 days. So if we're lucky, if all of these measures do have an effect, then I would be hopeful that certainly by the middle to end of April, we would see a noticeable effect.
And do you have an argument to make to people who aren't following these shelter-in-place orders, who aren't taking this seriously? Why is this so important to follow?
So, I think that young, healthy people tend to believe they're immune to severe health events. And so that not wanting to disrupt their normal lives and activities is understandable. And they recognize that, as is true for many diseases, the frail elderly or people with underlying illnesses like heart disease and lung disease are at greater risk of getting very sick and dying of things like the coronavirus. But I guess the two messages I would give are that, first of all, we do tragically have severe cases and even occasional deaths in young people. So they do happen. It's true they happen at a lower frequency, but it's not that they never happen. So I think there is still some risk to young people that they can get very sick. Secondly, we don't know whether even a milder or moderate case of this illness could produce long-term consequences in terms of lung function, for example. That remains to be seen. And then I would just make the argument that if we want to protect those among us who are frail and elderly, our grandparents, our parents, our coworkers, that we can potentially help with that by following these rules, regulations, recommendations, because we put them at risk if we transmit to them, and we're all part of the same society. So that would be the other argument for why we'd like even people who don't perceive themselves to be at risk to go along with these measures and take them seriously.
And I think at this point, everyone really wants to know, when will this be over? And some people have said perhaps, this will no longer be necessary by summer. Others have said we may need some measures of social distancing for the next 12 months. I mean, do you see an end to this, or when do you see that happening?
So I think no one can really predict what's going to happen with this virus. So people who extrapolate from flu and say warm weather will make this disappear, that might happen. There are reasons to think there could be an effect of warmer temperatures. There are reasons to think there might not be. I don't know the answer to that question, and I would argue nobody really knows. We'll have to wait and see. But even if it diminishes during the summer, that doesn't tell us what will happen next fall or next winter when cold weather returns. So I think we just don't have the answer to those questions at the moment. I think the challenge is when can we get back to letting people go to their place of work, have in-person classes, do recreational activities in a safe way, and is that this summer, or is it late spring? Is it in the fall? We just don't know. And I think one of the problems is we're still figuring out how we're going to do that and what types of information we'll need to guide those decisions. So if people would say, well, officials and experts are waffling on that and not giving us clear guidance, I would say that that's a correct statement, because we just don't know.
All right, that was Dr. Arthur Reingold with Assistant News Director Adia White. Dr. Reingold is a professor of epidemiology at UC Berkeley School of Public Health. I'd like to share now some of the information that was shared a little earlier tonight at 5 p.m. There have been special broadcasts on KBBF, our sister station KBBF, in the Spanish language, and those have been going on Tuesdays from 5 to 6. Some of the important things that they talked about was that the county is doing everything it can to reach everyone in the community and trying to communicate directly with the Latino community. Senator Mike McGuire is the one who I talked about, who's coordinating a blood drive in the town of Sonoma on Friday. You can look to his office for more details. They mentioned that there was an 800 number, and I haven't tried this myself, but it's 800-985-5990 for people who experience stress, anxiety, depression, or need emotional support. And I think that's probably just about all of us, so don't be ashamed. Reach out to friends and loved ones, reach out to whoever you need to reach out to get some help. There was a discussion from James Gore at this 5 o'clock town hall that the aid from the federal government is not going to be helping the undocumented, but local officials are working with senators to determine how aid can be provided to everyone in the community, regardless of status. Now, just to end tonight, we asked our friend Eki Shola, one of the most amazing creative people in our entire community. Eki lost her home in the 2017 fires, and she's been a full-time musician ever since then, doing some of the most amazing work. She pulled together some musical excerpts, something fresh from her and something from her friends. And here's Eki Shola. She's going to be joining us with some great music.
There's no right or wrong to creativity. Fight the master. Fight the expectation to stay in stagnation. Is no right or wrong. There's no right or wrong to creativity. Fight the master. Don't stay in stagnation. There's no right or wrong. Yeah, yeah, yeah. If you're not yourself, what kind of life are you living? They say peaks and ends matters. So I found a reason